go ahead and get started. All right, guys. So welcome to our newest Body Signals workshop. For those of you that don't know, every single month we're doing a new topic. So this entire year we're dedicating a new topic to every single month. This is already our 6th topic of the year. We've done things like allergies. We've done things like how to raise healthy children. We've done lower back pain. We've done a whole bunch of different topics. This is our part 2 of the adult onset FAS series. In other words, falling apart syndrome. Our last month was all about upper extremities, so shoulders, elbows, wrists, and hand issues that we commonly see in our office. Now we're switching it to the other side of the body, talking about the lower extremities, so hips, knees, and a little bit of the feet, okay? So we're gonna go ahead and just jump into it. With the body signals, the reason that we call it body signals is because that is really what a symptom is, right? Whether it is you're dealing with hip pain or knee pain or migraines or asthma, whatever the condition or the symptom is that you're feeling, it's a signal from the body, okay? Is your body intelligent or is it stupid? What would you say? Intelligent, extremely intelligent. It's the most intelligent machine that we've ever seen, right? We still don't know how majority of it works, right? So it's an incredibly intelligent machine that is capable of so many things. So if we can trust that your body is intelligent and base our approach to that, not that it is this dumb machine that doesn't know what it's doing, then we can start to think of these symptoms as really just body signals. Something is going on underneath the surface. That is why the symptom is there, okay? So your body's way of asking for help is through body signals, but the question is are you listening, right? Are you listening, or are you constantly shutting your body up and ignoring what it's trying to tell you, right? Because that is what your symptom is. That's why we call it body signals workshops. That's why every single month we're coming over a new body signal that is super important to understand why your body is telling you. So today we are focusing on lower extremity problems. So lower extremity, what we commonly see is the lower extremity could be things in your lower back. Issues with the lower back. It can be hip pain, it can be knee problems, leg pain, ankle issues, and even foot problems. So basically the entire lower kinetic chain of your body is what we're going to be talking about today. Now, many times there is a domino effect that occurs based on where the issue originates, and then it's kind of like just over time through wear and tear, through use, excessive use. What happens is it actually starts to go either up or down that extremity. So that's why we call it falling apart syndrome, because how many of you can relate to maybe you've had like a hip issue that then kind of over time went its way down, and then you kind of developed like a knee issue, and then over time it kind of worked its way down to your foot or whatever, or maybe it worked the other way, up the body. But we call it falling apart syndrome because it's not just growing old, right? It's not just part of life. It's really just a matter of ignoring what your body's telling you and then just waiting for it to kind of just spread to other areas, and then that area gets worn down, and then it spreads to the next area. And some of what we're going to talk about tonight is how that process works and early signs of detection that you can actually use to know, okay, well, if this is happening right now, these are possible things that can develop over time, and I can prevent that from ever happening by addressing it right now. Okay, so we're going to give you some tips tonight. Okay, I always like to go over this. We've done this with every body signals workshop that we've done so far, and it's a really super important diagram. It's really simple, but it's super important. What this is, it's the illness wellness continuum. Can you see over there? Yeah. Okay. So illness wellness continuum. The right side represents high-level wellness. Think you are as healthy as you possibly could ever be. Your body is not having any sort of symptoms. It's not having any sort of conditions that's wearing you down. You're able to do everything you want to do. You have the highest quality of life. That's high-level wellness, right? Now, the far side of the spectrum, other side, is what's called premature death. So essentially dying at an early age, okay? So we got the two opposite extremes. Now, every single one of us in this room is somewhere on this spectrum. Every single one, there's no exception. It's just a matter of where are you right now? Are you dealing with symptoms right now? Because a symptom is a sign that your body is under stress, okay? And stress means that we're on this side, okay? If you're not dealing with any symptoms, that's great, but what we got to make sure is that you're aware of how your body works. You are educated, which is why it's so awesome you guys are here tonight, because you're taking action. You know that, like, okay, it's not okay to be in pain all the time, or maybe you have a loved one that has been dealing with pain, and you want to make sure that you're helping them learn how to take care of their body better. And then it's the growth of actually like applying these things that you're actually learning to continue working in this direction. Because the thing is that every single one of us is on the spectrum, but it's not like we're just like stagnant in one spot. We're literally always, depending on the day, literally it varies from day to day, if we're going in that direction versus this direction. Health is dynamic, it's never just stagnant, right? So based on the choices that you make, it's either you're heading in this direction, it's good for you, you're creating more toxicity, you're creating more stress, and you're going this way, or you're doing what's better for you, you're heading this way, right? And taking the right steps. So super, super important to kind of realize that the symptoms tell you in what direction you're headed. If you're dealing with symptoms, that's automatically on the left side. That makes sense, guys? Okay? Your body's not designed to be in pain. It's not supposed to be in pain. Healthy is normal, unhealthy is abnormal. It may be the norm, it may be common. A lot of people are in pain, but you can't judge your health based on just how little pain you're in, right? Another important thing is that there's a difference between feeling and function, okay? There are 3 parts of your central nervous system. Your central nervous system is your brain and your spinal cord, okay? That's where all signal and all communication, all health has to flow from above down, right? From the brain down. Now, if you dissect any nerve in your spinal cord, it's made up of these 3 parts, these 3 domains, right? There is one part motor nerves. Motor means movement, so it goes to your muscle. It tells your muscle to move. Every nerve in your body is responsible for these 2 things. So there is motor nerves, there are sensory nerves, and there are autonomic nerves. Now, autonomic nerves are basically what's responsible for your automatic functions, the things that like keep your body running. Your immune system, so sinus and allergies, your energy levels, your digestion, your breathing, it's controlling all of that, the things you don't have to think about, it just happens behind the scenes, right? So that's another part. And then the last part is the sensory component, right? But sensory can even be broken down into smaller parts. Sensory can be broken down into posture. It's called your proprioception. It's basically this big a big word that just means like being aware of your posture. So one of the things we talk about is like the 3-legged stool. For those of you that are patients, you already know what that is. That if you're aware of your posture, that's one of your bad habits you want to start breaking, is just being constantly like in a slouch position. But your nervous system is what's responsible for being aware of your posture. So proprioception is what that's called. Now hot and cold also, that's another part of the sensory component. And then pain is just that third. So really if you break it down into like percentages, it's less than 10% of your nervous system is responsible for sensing pain. So what does that mean? Is that your nervous system, your body's master system of your body, can be under stress without you actually knowing about it. It can be under stress without you actually feeling pain. Does that make sense? How many times do you ever like hear of people that go to the doctor for like a routine checkup and they think everything's all good, and then a test comes back that they're dealing with something way, something that they never actually expected, right? You can't base your health based on how you're feeling, if you're in pain or not. That's only 10% of the equation. That makes sense?
I'm really hot and cold, I'm sorry.
Sensing, it's temperature sensing.
Oh.
So just knowing whether it's hot or cold, that's a part of the sensation aspect of your nervous system. Okay, so it's three main things: posture, pain, and then temperature. Okay. So let's dive into today's specific topic, because that's kind of like the overarching. Like we just have to understand those basic concepts of how the body actually works. Because one of the things that I'm becoming more and more aware of as I'm in practice and I'm kind of dealing with people every single day is that if you guys could only understand how intelligent your body is, and this goes for anybody, not even people that are just in our practice, but if we just understood how our body actually worked and how intelligent it was, we would know how to actually, we'd be more willing to actually take better care of it, right? It's not just this dumb machine that just breaks down over time and you just got to replace the parts, right? It's literally designed to function super, super well. And if we can start to understand that a little bit better, it's going to be way more, you're going to be way more like motivated to actually be proactive and take care of it, because your body is incredible, okay? The anatomy of the lower extremity, okay? There's a lot of different factors that are involved. We're going to jump into it pretty in-depth here, but the lumbar spine is your bottom 5 vertebrae in your spine, okay? So L5, L4, L3, L2, L1, it's those 5 underneath my hand here, that is your lumbar spine, okay? It's the lumbar spine, all of these nerves that come out through there, those are the nerves that control everything below it. So they control your leg, they control your hip, your knee, your foot, all the muscles that are involved. Not only that, but they also control super important functions like digestion, reproduction, prostate gland in men, super, super important nerves. But we're dealing with the lumbar spine, okay, because it's controlling everything below it, so we can't ignore that from the equation. We're also dealing with the sacroiliac joint, so immediately below the lumbar spine is your pelvis, okay? Now your pelvis is made up of 3 bones. 2 big ilia, that's these bones right here, your hip bones, okay? And then this big triangular bone, it's called your sacrum, okay? The reason it's called your sacrum, interesting fact, is that years and years and years ago, this was considered like a sacred bone. That's where they thought that the soul lived. This was like it was way, way back into like hundreds and hundreds of years ago, but they called it the sacrum because they thought it was like the yoga soul, and they lived in the sacrum. Now, what happens is these 3 bones, they form your pelvis, okay? Now, the sacroiliac joint, okay, so these are your ilia, and your sacrum is here, so a joint is what connects 2 bones together. Your sacroiliac joint is where they meet, okay? Now, your sacroiliac joints, a lot of people think that they don't move, but they actually do move. What happens is, when you walk, and you move your legs like this, there are these tiny micro movements of your sacroiliac joints that actually pivot, okay? What happens is, when you lift your leg up, if you're moving this side, your right SI joint moves, your right ilia moves back, and then your sacrum goes forward, and it's this kind of like called counter nutation, okay? It's basically this like back and forth motion. But then the exact opposite happens on the other side. So there is this motion that's supposed to be happening, and one of the things that will occur, and we'll dive into it, is the subluxation of that joint down the chain, okay? Now your knees are made up of 3 bones, okay? Actually 4 bones. So let's take a look here, your knees, and bring this into the camera view here. So your knee is made up of your femur bone right here, your tibia or your shin bone, then you have this long fibula bone. It's one of the only bones in your body that's not weight bearing. Okay, it's just kind of a floating bone on the side. And then you have your patella or your kneecap. Okay, so those 4 bones make up your knee. Okay, just a whole bunch of ligament attachment and muscle attachment that's going on there, and we'll talk about how to take care of all that. And then you have your ankles. There's a whole bunch going on in your ankle. You got the bottom of your tibia, you got your fibula here, your talus, all these tarsal bones, your calcaneus or your heel bone, and then you have all your metatarsals and phalanges. There's a whole lot that can go wrong there. All of those bones are designed to move. They're not designed to just be jammed up, right? So through extremity adjustments, Dr. Emmanuel and myself are sports specialists, so we do a lot of extremity adjusting, making sure that all of those individual bones are moving properly, because that can actually really cause a lot of different issues in the ankle and feet. And if you look at the entire lower extremity from the hip down, it's what's called a closed kinetic chain, okay? What that means is it's weight bearing. The lower extremity is weight bearing. If your upper extremity, we talked about this in last month's workshop, how the upper extremity is considered a open kinetic chain, meaning that it is meant to move a lot, there's a lot of range of motion, but it's also very susceptible, it's not very stable. Your shoulder joint is super unstable. That's why there's a lot of shoulder dislocations. You might have heard of people. There's not a whole lot of hip dislocations because your hip joint is a solid. I mean, if you look at this ball and socket joint, you see how much that femoral head is sitting inside of there versus this ball and socket joint, how it basically barely even in the groove. It's just kind of like there, right? Very unstable. That's why shoulder dislocations happen a lot more. But it's called a closed kinetic chain, so it's designed to be very, very stable, but there are some weak links in that chain that are often creating a lot of different lower extremity issues, okay? So all that makes sense, kind of the anatomy of the lower extremity?
Questions. People who've had hip replacements typically get better if they have surgery. Surgery's terrible, I'm saying. They get better faster than knee surgery. Is that because that's such a big, with the sacrum so much of a big component, and then the knees have so many things else going on?
Yeah, I mean, usually what happens with hip replacement surgeries is when it's time for hip replacement, because there is a time and place for a hip replacement, but what's happened is there's been so much wear and tear, so much grinding on bone, that they've gone from a very flexible, mobile joint to completely stuck and no range of motion. So when they put an artificial one in there, it's got all sorts of motion, so they can actually recover a lot faster, versus a knee, which you don't want to actually move too much because it's supposed to be a fairly stable joint. It's not supposed to have the range of motion.
That's why it's more painful, it doesn't work, so.
Yep, exactly. Okay. So let's go into some of the hip problems. Good transition here. Now your hip, we gotta kind of distinguish what is your actual hip. Okay. So many times people come into us with the understanding that your hip is your hip crest, right? That is actually your ilium. Okay. Your true hip joint is this. It's your ball and socket joint. Okay. It's called your femoral acetabular joint. Acetabulum is the socket, and your femur is right here. So if you actually put your hands on your hips, you feel that hip crest, right? That is your ilia. It's all AKA nickname hip crest, okay? But if you go down, you'll feel this bony prominence, okay? Right on the sides. That is called your greater trochanter. It's part of your femur bone. It's this part right here that's sticking out. Okay? That is your true hip. That makes sense? So it's good to kind of distinguish that. All right, so let's talk about. All right, let's talk about how hip issues, what we typically see in our office, how they originate. So there's a whole lot going on. Okay, there is like I said, and everything starts. We got to look all the way up to the lumbar spine, and then we can also work our way down to the SI joints. These things right here, we got nerves coming out through there. You have your ilia, you have your femur. There's a whole lot that can go on that can create a lot of hip issues. But one of the things that we see all the time in our office is when there's an SI joint subluxation. Okay, a subluxation, remember, it's a bone that has gotten jarred out of its normal alignment that creates soft tissue irritation and inflammation that stresses the nervous system. Okay, and creates symptoms and conditions. So when there is the ilium has gotten jammed out of its normal position, so ilium, we're talking about one of these, either left or right. One of those bones has gotten shifted and stuck out of its normal position. It is a big bone, right? It's a huge bone, and that's where your hip attaches into. So let's say that your ilium, it's gotten jammed into this position. Okay, so it's kind of gotten what's called an ion ilium. It's, in chiropractic terms, it's a internal subluxated or jammed joint. Okay. What that does is by shifting it this way, can you guys, because this doesn't really move, it's all screwed in, but what happens is when that shifts, does that make sense how it actually affects your actual hip joint itself? Okay? Now imagine if you have an IN ilium, which is creating this outward pull of your hip, but you go throughout your entire year of life or whatever, walking or moving in that funky position, does it make sense how it's going to create this abnormal stress into the actual hip joint? That make sense? Okay. Now, it can move in other directions too. It can create an EX position, which is an external or outward misalignment of the ilium too. Okay. So what happens there is it goes outward, but then your toe goes in. Do you ever see people walking around where they have this inward toe? Almost 9 times out of 10, it's an upstream issue happening in their SI joint. Right? If you ever next time you're at the mall, next time you're watching people at the store, whatever, or at the airport, watch people walk. You'll be surprised how many people are walking with their toe out or their toe in. Okay? And most of the time, it's actually a hip issue. It's a lumbar or pelvic issue. Okay? Kind of interesting. Now, you can also have one hip that's higher. You can have one hip that's lower. You can have all sorts of different things that happen. And everything that happens above occurs below too. So it's going to affect the lower extremity. Okay? That's why when we, take x-rays, we take a look at it and see exactly what's going on. We can actually see exactly what's going on. And then when we start adjusting it, we take that stress off of it, getting that motion restored and restoring that proper placement. lower extremity issues resolve, okay? Rather than just adjusting, like if we only looked at the hip, but we kept everything else above it in the exact same position, we're gonna hit a ceiling pretty quick as far as how much results that we can get. That make sense? Now, another thing is with a lumbar spine, so when you walk, what happens is your pelvis should be moving like this, like I mentioned, okay? Sometimes if it's jammed, it'll kind of have this like little waddle gait that happens. Your femur, your thigh bone, they should be going like this, right? So we got this kind of like rock with your SI joints happening. Your femur should be going like this, right? But then your lumbar spine with each step you take should be going up and down, okay? These discs in here, that's how they stay pumped up and they're actually like full of fluid, is with that upward motion. Think of it like a sponge. If you take the pressure off, the kind of fluid comes back in, and it's really, really good for the disc to start getting that kind of fluid pumping in and out. So that's why movement is so key. Like just sitting down for 8 hours a day on a computer and not moving puts so much pressure on those joints and creates a lot of jamming. That's one of the reasons why you see discs, when you take an x-ray, you see some discs that get way narrow, right? This is the disc that we're talking about. So it starts really compressing. Okay, so it's super important that that stays moving. That's why standing desks, wobble chairs, it's so good to keep things moving rather than just compressed all the time. Make sense? So there's a whole lot going on. Now imagine if just one of those three, whether it's SI joint stops rocking, femurs stop going like this, or the lumbar spine stops going up and down. Imagine if one of those three that are required for you to walk normally and keep your body healthy, if they stop working. Imagine 3 people in a canoe, one of them stops working, the other 2 have to work harder, right? What happens when you start working harder? You get tired, you get fatigued, you get worn down. It's the exact same thing that happens in your joints. So it's this whole like cascade issue that can happen when one or more areas stop working how they're supposed to. Okay? Movement is super, super key, and that's how your body's designed to be, is moving. And that's really what we're helping you do, is move better, get your body moving so it's not constantly just stuck and compressed all the time.
I just want to say, with the knees, right, if it's just bone on bone, you've had surgery, there's not much you can do about that. So it starts moving to the hips and then neck. So what do you do about the knees? You can't fix them because they're bone on bone.
Yeah, if there's already been surgery on the knees, we leave the knees alone, but we address everything along below it, making sure that we keep those areas moving. Because, like I said, it is a matter of time. Because surgery, if there's been rods and screws and all sorts of other things being put in place, it alters the normal mechanics of that joint. Which, if one joint stops, if it goes from, instead of working at 100%, if it goes down to 60, it's going to automatically have to make the other areas work harder.
So it's like longer to get the hips right and the spine.
It creates a little bit of it definitely is it's an uphill battle, but it's something that's worth fighting, because if you don't do anything, right, and you just kind of let everything just wear down on its own timing, well, it's going to happen eventually, right?
Yeah.
So it's definitely something that's worth doing.
Sounds
for
good,
sure.
thank you.
Of course. Okay, let's go into what is a subluxation and a more kind of like in-depth conversation here. So the subluxation is a joint misalignment. Okay, that's where it all starts. You can't have a subluxation without a joint misalignment. It has to get out of its normal position. What that does is, if you think of it like a sprained ankle, where you roll your ankle, right? Anybody ever had that? Rolled ankle, sprained ankle. Okay, not fun, first of all, right? But what happens is when you jam something out of its normal place, it creates soft tissue damage. In the form of your ankle, it'll create things like a sprain or a strain. You overstretch a muscle or a tendon or a ligament, sprain, strain, soft tissue damage, right? The same exact thing happens in your spine. So if it jams out of place, there's ligaments and tendons that are connected to your spine that they get overstretched, overworked, right? When that happens, inflammation results. Inflammation is AKA swelling, okay? So think of when you roll your ankle and it starts swelling up, it gets really puffy, right? That creates nerve irritation. So the nerve irritation is what creates the pain, right? You never feel pain unless one of those, remember how we talked about 10% of your nervous system is responsible for pain? You wouldn't feel pain if you didn't have a nervous system, right? So it's the nervous system that gets irritated that creates the pain that you become aware of. So it's the inflammation that puts pressure on the nerve, it creates nerve irritation. Now, your body, is it smart or stupid? Smart, okay. So what would a smart body do to actually protect it?
Offset it.
It'll offset it, right? But it'll create a guarding mechanism. Your muscle will spasm, right? Your muscle is designed for two different things. It can contract and it can spasm, it can guard, right? And it has two different purposes. So it's movement and locking down, right? It's got two main purposes. So the muscle spasm, the locking down occurs, so that you're basically, if your muscle won't fully contract and relax and whatever, and like move how it's supposed to, well then of course you're not gonna be able to use that area, right? So muscle spasm, while it is not fun to deal with, it's actually a very good thing that your body does, okay?
It becomes tense, right?
What's that?
It becomes like tense.
It becomes super tense, so that you reduce how much that joint is actually moving, so you don't create further damage, right? Now, that's when the lost inhibition occurs though. So while it's great that the muscle spasm happens initially, when there's less motion, then lost inhibition occurs. Lost inhibition basically means any joint in your body that stops moving, it starts to degenerate, it starts to fall apart. If you ever heard the term, if you don't use it, you lose it, right? In the world of like the human, biomechanics, what we say is if it's stuck, it's dead. If it stops moving, it's dead, okay? So any joint in your body, if you stop using it, it's just gonna start decaying, okay? Because it's designed to move, that's how it lives. So lost inhibition just means it stops moving. Joint fixation then, if it really stops moving again, then the joint completely gets fixated, and that's when you start to see this whole degeneration process happening. And this is in your spine specifically, but this can happen in your hip joint, this can happen in your knee joint, any joint in the body. And then, AKA, that whole process of degeneration is called arthritis. Osteoarthritis is the most common. Osteoarthritis is another word for degenerative joint disease, degenerative disc disease. If it's in your spine, it's all the exact same thing, but it just means it's breaking down, it's wearing down. Okay, that makes sense? So that is a subluxation process. Now, let's jump to the next part of the lower extremity, the knee problems, okay? Knee problems, like I said, so the knee is made up of 4 different bones. One of the things that we often will see, and this is why we do posture assessments, is that when there is a issue with the hip or the sacroiliac joints, right, up here, when there's an issue there and it's brought out like this or it's brought in like that, it's called an EX, so externally rotated ilium. What happens is the knee then it undergoes torsion. That makes sense? So torsion, your knee is designed to only do this. This is the only motion it's supposed to do. Flex and extend, right? But if you imagine that you put a twist in it and it's weight bearing, and then you continue to use it, you run, does that make sense? That's gonna wear down pretty fast. Look at how much, so this is like the normal joint space. I hope you guys can see this. Normal joint space, okay? Because you can actually see this on an x-ray. There's supposed to be a nice thick space on the left and the right. When you have that torsion, does it make sense how one side gets narrower, right? So especially when you're weight bearing and you're using your body, you're squatting, you're doing jumps, you're whatever, you're standing all day. If it's constantly getting worn down, it's going to wear down the meniscus. You might have heard of like a meniscus tear. A lot of times it'll happen in like football or different sports. Tennis is super common. But when the meniscus gets worn down, it's only a matter of time, it's just a little pad, just a matter of time before it starts to tear based on all of that. So it's super, super important that your knee is sitting in the right position. Another thing that can happen is when this whole torsion happens, a lot of times it's further upstream. Rarely is it strictly a knee issue unless it was like a direct blow. You'll hear of like a, MCL tear in football once in a while if it's a direct blow or like rugby or something like that. Most often though, it's like a non-contact kind of thing. If you get like an ACL tear, usually it's non-contact. And what happens is they just kind of step weird, but it's because of the improper placement of everything else, right? It's just a matter of time before it starts to blow. But the kneecap, the patella, okay, this floating bone right here, there's 4 big muscles that attach onto it. It's called your quadriceps. Quad means 4. Okay, there's these 4 huge muscles. Now these muscles that are in the front of your thighs, where do they attach further up? On your pelvis. Okay, so So again, think of your pelvis and its alignment. If you have 4 muscles that are attaching right into here and onto your hip bone, and your hip is out of place, what's it going to do to those 4 muscles, or at least some of those muscles? It's going to start pulling, right?
Did you feel that before the knees, or you feel the hips? Or it's not before you across the knees, right?
Really, it's not like a for sure one size fits all kind of situation. It does depend. But regardless, there will be some tenderness in that quadricep area, because if it's pulling on one side, it's going to be almost like a guitar string on one side, super tight or like stretched, but then there's going to be one side that's going to be kind of shortened up, right? So in a minute, Dr. Manuel here is going to show you a really good way that you can actually start to loosen that up on your own and make sure that it's not constantly just getting pulled one direction, okay? Now, foot problems. Sometimes, so we see this all the time, like when you guys are face down on the table, you ever wonder why, sometimes we'll like look at your feet, because we're looking at you from this angle, right? We're like behind you, like face down, right? So we can take a look at your feet. And one thing that we'll see a lot of times is this, like, instead of normal alignment, your heel goes in or it goes out. It's called pronation or supination. Just like your hands can pronate and supinate, your ankles, okay, supination is going in, pronation is going out. Your ankles can do the same kind of thing, and they call it the same as pronation and supination. But what happens is, law of gravity, if you're not standing on a solid foundation, you're in pronation or supination, and you continue to wear down, well, if the forces of your body against gravity, against the ground is not going into a solid foundation, then it just has to go somewhere. So it's going to build either into the outside or the inside of your ankle. It can go into your knee. It can actually work its way up over time, right? It's just like domino, okay? So that's one thing that we often see. Now, with us being sports specialists, there's different types of adjustments that we can do to actually correct and restore the motion back into the calcaneus, because the calcaneus is the strongest bone in your ankle. Your calcaneus is the heel, right? It's the heel bone. So when that bone gets stuck in pronation or supination, there's adjustments that we can do to actually help get it into a better alignment, so that when you stand up, you can actually keep it in the right position. Make sense? Yeah. That's one of the, what's that?
Said I need it.
You need that? So remind us on the next visit, we can take a look, okay?
Okay.
So,
I'm extremely flat-footed. Does that have?
yeah.
Oh, okay.
Yeah, I'm actually going to jump into that right now. These are
So
really
it
good
also-
transitions.
So it also has to do with like when you notice like your shoes get worn out in certain areas
Yeah.
more than the others.
Yep. You guys ever notice that? Yeah. If you look at you can look at either the sole of your shoe, or you can just look at the back lip of your shoe, the back part of the sole. If you see one side that's like wearing faster than the other, that's a sign that you have either pronation or supination. Yep.
Does everyone have that, or just some people, or?
No, yeah, it's a sign of abnormal weight distribution, and usually it's. I mean, it is, like I said, it is common, but normal is this middle one, right? Healthy is normal, right? So, this brings me into Tim's question. You guys ever hear of plantar fasciitis?
Yes.
Plantar fasciitis? Ever deal with it yourself? Ever have it? Okay. So we see a lot of people with plantar fasciitis. And so the plantar fascia, plantar means bottom of your foot, okay? So palmar means front of your hand, plantar means bottom of your foot, and it's just the same kind of concept. But plantar, we're just looking at the foot from the side. Let me get over here. Looking at your foot from the side, there is this fascia. A fascia is just a connective tissue that keeps things in the right position. But the plantar fascia specifically runs from the tips of the bottom of your toes all the way to the bump on the bottom of your heel. Okay. Now, when it is considered plantar fasciitis is when the fascia has gotten so tight, think guitar string, it's gotten so tight and wound up that there's no suppleness to it. There's no give. It's just literally like pulled the entire time. So the second you put your weight on it, it's pulled even more. You see how there's supposed to be this nice arch there? Okay, imagine this person is non-weight bearing. They're just laying down. So there's no weight, right? So they have a decent curve and they're in their arch. But then the second that they put their weight down, that fascia is connecting to the two opposite ends, and you put the weight down, it stretches even more, and you're jumping off the, you want to get right off your feet and sit back down because there's so much pressure, right? Now, the arch is super, super important because what you want to do is you want to have an arch that is not only there when you're not weight bearing, but it's there when you're weight bearing too. And it's one of your first shock absorbers. You need to have a little bit of an arch, a little bit of a give in your foot to be able to take on you walking, you running, you whatever, you're using your body. But if you don't have that arch, then instead of you being able to absorb it, some of the shock in your foot, then it goes to the next joint. And the next joint is either your ankle or your knee. And if that can't take on any sort of shock absorption, then it goes into your hip. But most of the time, it just goes straight into the spine. Because the spine is really the next thing that is designed. It's one of your primary shock absorbers. So if you don't have it in your foot, then it goes basically straight up into the spine. And if your spine doesn't have an ideal curve, if it's straightened out, if it's leaning, if it's tilted, if you got scoliosis or whatever, then it's just going to wear down the spine even quicker. That makes sense? So it's really, I mean, everything's all connected. But going back into the spine though, this plantar fascia, it doesn't just stop here. Fascia covers your entire body, and what we've recently discovered in like anatomy and in research is that the plantar fascia is actually a continuation of what's called the superficial backline. There's this superficial backline of fascia that runs from the tips of your toes underneath your foot and runs into your calves, into your hamstrings, and then into your back, and then on the top of your head. It literally is a continuous line. Okay?
Repeat that one more time.
So look at it this way, okay? So from the bottom of my toes, it goes to your heel. From your heel up to your knee through your calves. From your knee all the way up to your hamstrings. From your hamstrings up to through your back, through your what's called your rector spinae muscle, all the way up to your neck extensors. Literally wraps around. It's all connected. So if you do if you're doing yoga and you do like a cobra position, that entire superficial back line relaxes. It shortens. But then if you go into the opposite position, you do like these, that entire superficial back line stretches. That makes sense? So the reason I'm bringing this up is that it's another reason why taking care of the structure of the body and not just zooming in on this one little area, if you have plantar fasciitis, we're only zooming in on just this and we're ignoring everything else. Again, we're going to hit a ceiling. We're not going to be able to really get this taken care of. So that's why working on your posture, getting things in the right position, relaxes that entire superficial back line, and actually can take care of a ton of that plantar fasciitis. That make sense? Kind of interesting, huh? All right. What kind of things could you be doing at home? Foam rolling. Have you guys ever tried foam rolling before? Foam rolling? No? Yes? Okay, some yeses, some no's. I'm actually going to have Dr. Emmanuel come out. He's going to be our demonstrator. This is a foam roller, okay? And if you can try to get a little bit of this in the camera, that'd be awesome.
Of course.
So a foam roller is a way that you can get some of the adhesions or scar tissue or muscle knots out yourself. And basically all it is instead of somebody putting the pressure in through their hand, you're using your body weight to apply that pressure, and the foam roller is actually acting as like kind of it's not a full massage, but it's a way of kind of digging into the muscle and getting it done yourself, okay? Now, let's use some of this superficial backline, and let's work on some of the quads, or some of the calves here. So what you do is take one of your calves, you can do both sides, but starting with one calf, and you just roll. You start with origin. Origin means higher up, where it attaches. Start with the origin, and then you roll all the way down nice and slow to the insertion, which your calf muscles start from right behind your knee, and they attach into your heel. So you just go from origin to insertion, back and forth. Now, this is not a jacuzzi experience. You're going to feel some pretty tender areas most of the time, especially in today's day and age where we're doing a lot of sitting. We're doing a lot of unhealthy positioning. So there's gonna be some tender spots, okay? Modern life is unnaturally stressful, so we put our body through a lot, even if we're just sitting at a desk, okay? So you go back and forth for your calf. Now you can also do your hamstring, okay? So why don't you, if you can, roll it up. Let's start at the origin, so start kind of right underneath your butt. The hamstring attaches into your sit bone. It's called your ischial tuberosity. It is, here, let me just, ischial tuberosity is this right here. This is the bone that you're sitting on right now. Okay, the sit bone right here. That's where your hamstring's attached to. So you want to start right underneath your sit bone, and you just roll it all the way down to the bottom of your knee. Now, your hamstrings have three major, so your quads have 4, and your hamstrings have 3. There's 3 major muscles there. What you do is you go from top to bottom, right in the middle, and then you can kind of just twist your knee out to get to the outside, and then you can twist your knee in to get to the inside. There's 3 that kind of just like sit next to each other.
How often do you recommend doing it? My hamstrings are tight every day.
They're super tight. Yeah, so you can do it. You can do it like 2 to 3 times a day. At least once a day will still get you some results though. Okay.
If you want to add some, you can just.
Yep.
Okay.
How many repetitions?
So you do this for about 30 seconds to a minute, and I would do it 30 seconds to a minute on each muscle, each individual muscle. So we're talking hamstrings, 30 seconds to a minute on 1, then move to the next, and then move to the next. Quadriceps is 4 muscles. So this is how you roll the quadricep. So the quadricep attaches from the front of your hip all the way down to your kneecap. So you roll from basically the crease of your hip, okay? So if you bend your knee right where that crease is, or bend your hip, and then you go all the way down to the top of your kneecap. Now, your quads have 4 muscles, so you basically you can start on one side or the other side or right in the middle, and you just do like 30 seconds to a minute on one, shift your body weight a little bit, get a little bit more on the inside. You're gonna be targeting, it's not like you're gonna be able to focus on just one, but you still wanna get the different angles of your thigh. That makes sense? So this is a way that you can do this on your own and start to release some of that tension that's in there. Because a lot of times, like I mentioned, if you have one hip that is out, there's going to be more tension on one side than the other side. So you basically just kind of feel like, as you do it, you're probably going to feel like one side is a little bit more tense than the other. And just spend a little bit more time on that. Cool? Mm-hmm. Awesome. Now, exercise is another thing that you can do. One of the like landmark or like foundational exercises that really everybody should be able to do is the squat. Okay? Yeah. Now, think of this. I'm going to show you the diagram right here. This, or not a diagram, but like kind of a picture. Our body is designed to be able to squat. And we should have really good form. Right? Look back through literally all of human history. All of our ancestors, they all squatted like every day, right? They would go to the bathroom in the woods, squatting. They would sit down and they'd squat while they're eating. They would squat while they're cleaning. They're literally squatting all the time. But those evil things that you're sitting on has ruined all that. Because over the last few centuries, we've created chairs, and chairs have completely changed the game. They've completely created a weak core in our bodies. They've completely tightened up certain muscles. So now when we try to get into a squat position, everything is just so jacked up. That makes sense? So these are the things that it should be. So I have a 16-month-old. It's amazing to watch him like get into a squat position because it's picture perfect form, right? It's like, man, I hope he can continue to do that because as soon as you start sitting in a chair all the time, it's just gonna start going out the window. But this is what's supposed to happen. Your head is supposed to be upright so that you can look forward and relaxed. So you don't want to be like arching, but you should be just kind of upright, right? Not leaning forward either. You should have a big chest, meaning that your chest should be upright. You shouldn't be having your shoulders rounding in. A lot of times people have that, okay? Back is straight and solid, so you don't want to be rounding your back either. Your hips go below the knee or minimally to the knee, okay? So at the same level, it should be a horizontal line or your butt should go below your knee. And your body is balanced out. Your knees should be tracking over your toes and your knees should be apart. One thing that we don't want to see is when you squat down, your knees start going in like that. That makes sense? They should be going straight out, okay? Like that, so straight back. So, yeah, Dr. Mann can demonstrate in a second. But feet shoulder width apart and flat on the floor with your weight on your heels. That's one of the other common things. It's like if you ever go to the gym and you see people doing a back squat and their heels are off the ground and they're all on their toes, that's not how you're using all the arm muscles. It should be all glutes, it should be all posterior, backside, but as soon as you go on your heels, you're basically just using your calves and your quads, and it's not what you're supposed to be using when you squat. Okay? Make sense?
Yep.
All right, so Dr. Mann, why don't we demonstrate? So, first things first, yep. So, first things first is you do what's called a hip hinge. This is basically where you drive your butt back, and at the same time you start lowering down. Okay? What also happens is he has a nice straight back. He's not rounding his lower back. His chest is upright. His shoulders aren't caving in. Head upright, not going forward at all or looking too far up. And then what's happening with his feet are starting with a shoulder width stance. They can be out a little bit, 5 to 10 degrees, okay? And what you want to think of is as you're going down, you're pushing your knees out, and imagine that you have a continuous piece of paper underneath your feet, and you want to rip it apart. It's going to force you to focus on your actual foundation and actually gripping the ground, activating some of these glute muscles that should be activated. That make sense?
Now, how do we work our way up? Because
So-
I look at my niece, she sits like that every day, and I'm just in awe and jealous.
So there's different progressions, and there's a whole lot of ways to kind of like work your way up. The first thing you can do though, and this is just to basically get some muscle memory, some feel to like how to actually squat properly, is you can use it, you can assist with something. Take out some of the equation of like your body weight by holding on to something, okay? So if you hold on to a door frame or you hold on to something that is sturdy, if you like, what I like to do is I like to do this when I go to the gym and hold on to a squat rack. Just take the actual rack itself and just hold on to it because it's super sturdy, obviously. And you can just kind of sit there in that position and just kind of like move around, wiggle around. It gets your hips nice and loosened up. But that position is super, super good to just kind of get some of these muscles to loosen up. Because especially if you have a desk job and you're sitting down all the time, or I mean just everyday life, we're just always forward, muscles tighten up, and then if you try to go into a squat on your own and it's not ready to do that, like you're going to not be able to hold it at all. That makes sense? So just kind of holding yourself in that position and just you can spend 10 seconds and you're going to feel a lot of stretching there. Okay?
The difference between when you two squatted and when I try, I hear a lot of popping
Yeah.
and cracking sounds.
Yeah, exactly. And that's a sign that there's a whole lot of tension being stored inside your muscles and everything, that the second you put them to work, they're like,
Yeah, I'm like, oh God.
yeah, yep. So sign that, you know, it's going to be really beneficial to start getting some motion in, doing some squats, some, body weight squats are super good.
Thanks.
Another thing is for another exercise you can do, and this is for if you have any plantar fasciitis, or you know anybody with plantar fasciitis, is you can take a lacrosse ball, or you can even use a golf ball or a tennis ball. Lacrosse ball is good because it's made of solid rubber. It's got a little bit of give, but not too much. And what you do is with your weight supported, you don't put all your pressure on, all your weight on it, but you roll from back to front. Okay, you can actually do some circles too. And what it does is it takes that plantar fascia that it has gotten super pulled and stretched, and you put a little bit of a pressure underneath it to give it a little bit of a give, and you just kind of put a little bit of pressure. It's usually pretty painful, but it allows the muscle or the fascia to start to kind of give a little bit rather than just constantly yanked. So you can do that for about 1 to 2 minutes a day, or multiple times a day if you want to. But it's a really good way to take care of this at home, at least just getting some relief. But then really what we got to do, I mean, there's different ways to approach this all from a professional standpoint. The professional care can be, there's different ways to approach it. There's ART, it's called active release technique. Really, really great way to work out some of the muscle knots. Randy, you might be familiar with a little bit of ART, are you? Yeah? Massage therapist. ART is basically a way to activate the muscle. So you'll be with a trained professional that knows how the muscles work and everything, but they basically have you activate the muscle while they're putting some pressure into that specific muscle, and then contracting, relaxing, and it's an active thing. It's what's called active release technique. But it starts to actually release the muscle really, really quickly, and it breaks up a lot of the adhesions. Okay, ART is really, really good. Massage therapy, okay? We have an awesome massage therapist with us today. She's a patient of ours, and what massage therapy is really good at is, again, digging into some of those scar tissues, some of those adhesions that build when your muscles are constantly in this contracted position all the time, from driving, from texting, from computer, whatever. Your muscles will build adhesions that prevent it from being able to fully open up. So massage therapy is designed, especially like therapeutic, clinical massage therapy is designed to really start to break up some of those adhesions so your muscles have the ability to actually open up, okay? Physical therapy is awesome as well. Physical therapy is really, really good to, especially when you're dealing with like an acute injury. So let's say that you just got like you just tore your ACL, or you just had a hip replacement. PT is essential because they're gonna get you back from like not being able to use anything to getting you back to like doing the things you need to do, right? So they're really good at like the proper exercises and the things you need to do at home. Now, you can also go to an MD, a medical doctor, okay? What does an MD usually do? MD is like, they're part of the allopathic model. Now, there's a time and place for everything, okay? But allopathic options are going to be one of the following, guaranteed. It's gonna be heat and bed rest, okay? So you go to a MD with, let's just say you got a hip issue and your hip's kind of hurting. They will either tell you to put some heat on it and just rest, and eventually it'll kind of calm down, okay? Drugs, you can kind of just put something inside your body that'll just shut up that symptom and shut up that body signal. But the thing is that you'll start to feel better, and you'll continue to use your body, so you'll start feeling better, but your health is declining, right? That's really all drugs do, okay? Physical therapy, again, there is definitely a time and place. It's great for exercising. Steroid injections. You can also take a corticosteroid injection where they'll put a needle into whatever joint or whatever areas that's bothering you, and a corticosteroid is an anti-inflammatory. So remember back when I talked about the subluxation process and how it creates inflammation? Inflammation creates a nerve irritation, which creates the pain. So you can just kind of go into the middle of the process. Instead of addressing the root cause, you can just kind of address that inflammation. But again, remember there's inflammation is there for a reason, right? So steroid injections will just kind of get rid of the inflammation for a time, or you can just manage it with painkillers, or you can do surgery, right? Now, there is a time and place for surgery. There's a time and place for certain measures like this, but many, many times, that is the first resort. That is the first thing that people go to, right?
Yeah.
Some of us have been guilty of it. I have, right? I mean, before I started learning how the body actually works, the first thing I would do is go to the medicine cabinet, right? But now that we're starting to realize how incredible your body is, that if you actually listen to it, you can get it back to functioning better, right? There is a better way, right? How do you actually correct the actual root cause? Because a lot of this is really, it's very, very beneficial, but there's still that underlying issue, right, of why it's all happening in the first place. And chiropractic is one of the best ways to actually address the cause, okay? That makes sense, guys? Mm-hmm. Again, subluxation, joint misalignment, soft tissue damage, inflammation, nerve irritation, muscle spasm, lost inhibition, joint fixation. When all that happens and it continues down the kinetic chain, it results in a lot of lower extremity issues. We see that literally every single day in our office, okay? So, how do you know if you have a subluxation? Okay? Well, since most of you guys are patients here, you kind of have already been through the process, but the way that we determine it is there's 5 objective criteria, okay? There are instrumentation that we can utilize. That is where we can do a nerve study, we can do a muscle study, an EMG, we have access to that. That tells us, is there any inflammation, is there any heat coming off of your spine? Is there any muscle spasm that's happening by actually assessing the muscle and how much electrical activity? It's called an EMG. We can do that here in our office. That'll tell us how much stress your spine or your body is under. Motion palpation. Motion palpation is when, if you were doing a range of motion and we asked you to bend forward, we asked you to twist, we asked you to lean one way or the other while having our hands on that area. Palpation means like feeling, right? You can actually feel whether the joint is stuck or not, okay? Static palpation is what we do when you're on the table every single visit. The first thing we do is we have you laying. Static means like not moving. So we do some pressure and we can feel for the joint play. Every joint in your body is designed to have a little bit of a give. So we put a little bit of a pressure, it's called static palpation, and we can feel if it actually has any sort of motion. If it doesn't, that's one of the main things that we use to assess if there's a subluxation. Also a posture assessment, okay? A lot of this can be just detected from a simple posture study. Posture is the window into your spine. So if you look at somebody, from behind, you might see one shoulder higher than the other. You might see one, like I mentioned, you might see one toe out. You might see a head that's forward. Next time you're at the store, or next time you're people watching, like, take a look. You'll be able to pick up a few things because you guys have had a lot of education now, right? And you've been able to kind of like learn, okay, this person probably is dealing with maybe some issues in their shoulder blade, or maybe they're dealing with some issues in their glutes or whatever. Just by looking at structurally how structurally sound they are, right? And then X-ray. If you really want to just get to the bottom of it and you can take a quick picture, that'll tell you exactly what's going on. Cool? Mm-hmm. So that's how we do it here. Now, very, very commonly in our office, we already talked about SI joint and sacrum, okay? SI joint and sacrum. Now, why those are different, okay, so SI joint means these two bones are where these two bones connect. Now, we can also address the sacrum. The sacrum is actually made of 5 different bones. A lot of people don't realize that. So it's 5 different bones. That's why you see all these little nerves that are passing through here. Okay, so throughout development, at about 15 years of age, those 5 bones fuse into one big triangular bone along with the coccyx, or the really true tailbone, okay? All these bones actually just fuse, but we can actually, we see this a lot in kids because with kids, these are all they're all basically like separate little vertebrae. And we can actually adjust individual vertebrae and prevent, a lot of times like kids, they might have their legs in a brace because they found out that they had like hip dysplasia or they had some sort of hip issue. And we can actually adjust the sacrum itself individually, each one of the little bones, to make sure that that's in the right place to take the stress off of it. So that when they turn 15 years old and everything starts to fuse, it's in the right position and there's not under any stress, right? But then L3 and L5, you guys ever heard of the sciatic nerve? Mm-hmm. Sciatic nerve is the nerve bundle that forms from L3 and L5, L3, L4, L5. So these 3 nerves come into one and they form one little bundle that goes all the way down the back of your leg and your foot. So sciatica is just the irritation of that, and a lot of times it's a result of the stress right here. Okay, subluxation. Okay, that's what we typically see in our office. It's a subluxation in either L3, L4, L5, sacrum, or SI joint. That's one of the most common things, and it responds super, super well. Now, how do we approach it? We have this design. It's called the 3-legged stool. This is how you're going to get the best results in our office, okay? When we address it through, number 1, breaking bad habits. You got to break bad habits. Most of what causes this in the first place is just stress. It's just repetitive micro traumas every single day. Looking on your phone, it's crossing your legs, it's twisted up while you're sleeping. It's driving, it's having a thick wallet in your back pocket all the time, and you're sitting on top of that. There's so many different things that just build and build and build. It's wearing a heavy purse, it's wearing all these different things that are bad habits you need to break. If we're gonna get this corrected, you gotta break those bad habits. Add specific exercises. It's your muscles that hold your spine in the right place. If those muscles never actually get stronger, we can adjust you all we want, but if they're not able to hold it, as soon as we start spreading out our adjustments, we're losing progress. So you got to add in those specific exercises, okay, and do them every single day. Chiropractic adjustments. If your spine's not moving, if your nervous system is never functioning well, then again, we're not going to be able to get there, right? So the chiropractic adjustments in rhythm is how you get it done, okay? That's kind of the recipe. When all 3 of those things are done at 100%, that's how you're going to get the best results, okay? Make sense? Again, you will never even know if you have a subluxation unless you actually get checked. You have to get checked by a chiropractor, okay? And here in our office, that's how we do it. Now, if any of you guys know people that are dealing with any sort of other, any loved ones, if they're in the Charlotte area, if they're not, let us know and we can find somebody that's in their area. we have a network of people that do corrective care, right? We want to help people. We know that the allopathic model, the medical model, is not the way. It's not the way that we should be going, and it's actually making us sicker and sicker and sicker. So if we're actually going to make a difference in not only our lives, but our loved ones' lives, and actually make people healthier, then we got to teach the truth, right? So let us help you, right? If you know anybody that's in the Charlotte area, we would absolutely love to take care of them. If you know somebody that's in a different state, different city, whatever, let us know, and we can try to find somebody. Okay, we're trying to help you guys out. Now, procrastination is literally one of the worst things that we can possibly do, because if you just ignore it, or you just don't listen, you don't listen to your body, or you just kind of put it off and be like, oh, eventually it's going to go away, right? It never does. It might calm down a little bit, but then you continue wearing it down, and then eventually it becomes an issue in another area, and it continues to spread. So procrastination is not the answer. Taking action, getting checked by a chiropractor, that's really how you're going to make sure that you and your loved ones are as healthy as possible. Okay? So if you guys do know anybody, if you'd like to make an appointment, we do have availability in our schedule over the next week or two, that we can actually fit somebody in if they're looking to actually take action. We can do an assessment. If they book their appointment here in our office over in the next 2 weeks, it's completely complimentary. So we're going to be able to sit down, figure out exactly what's going on. We can take an x-rays, any necessary x-rays, that's all included, as well as the doctor's report. On the next visit, we can go over all the findings, go over the recommendations. If it's something we can help out with, great. If it's something that, a massage therapist would be a better fit, we've got to do an assessment first. Cool? Awesome, guys. I hope you guys got something out of tonight. I appreciate you guys taking some incentive and then actually staying late on a Thursday night before a holiday weekend. But I appreciate you guys. We'll see you all at the next adjustment, okay?
Thank you.